You're watching CBS 12 News at 9 a.m.
With the pandemic surging, more hospitals in South Florida are finding themselves nearing capacity. As they fill up with COVID patients, other sick people may have trouble getting the care they need. A woman with stage 4 colon cancer recently went to an ER near Fort Lauderdale after getting sick from chemotherapy. Her husband says she was left alone in the waiting room for 5 hours because there were no free beds. So what happens when a cancer patient has an emergency? We want to welcome Dr. David Dodson. He's an infectious disease specialist and board member at the Promise Fund of Florida. Dr. Dodson, thanks for joining us this morning.
Thank you so much for having me.
So what advice would you give cancer patients who may be concerned about getting emergency treatment if needed? What kind of precautions should they be taking?
Well, the big picture is right now our healthcare system and our hospitals are stressed by the number of COVID patients. So the hospitals, have their beds filled, their ICU filled, and then in the ER, it's sometimes longer wait times. So you keep that in mind. But if you have a cancer and you have a complication or a problem, you can still get care at the emergency room. You may have to wait, but you can still get care. So I would encourage people, even though wait times and things may be worse, to not hesitate to call their doctor and to get to the emergency room if necessary.
And what about cancer surgeries? Are you seeing those being postponed right now?
Yes, so it varies by hospital to hospital, and some hospitals have canceled quote-unquote elective surgeries. But if there's a surgery that's urgent or critical, those still get performed. So if somebody needs a surgery that is important medically, it'll still get done.
Like you just mentioned, some elective surgeries have been put off during the pandemic. Also, some screenings have been put off. And a new report just found that the cancer diagnosis rate dropped by nearly 50%. Many attribute the drop to people putting off those screenings. And we just want to know, how dangerous can this trend be?
Right. So the sequence is that screenings lead to diagnoses, and then diagnoses lead to early treatment. And the earlier you treat a cancer, the better off it is. So the JAMA study you referred to, Journal of the American Medical Association, showed that about 50% of screenings were decreased by about 50% last year because nobody wanted to go near the hospitals. So what happens is the cancers are still there. It's just we're not detecting them. So I would encourage everybody to get back on regular cancer screening regimens, whether it's for breast, cervical, or colon cancer, and make sure that their screenings are up to date, because the earlier you get treatment, the better.
All right, some really important information there. Dr. Dodson, thanks so much for joining us this morning. We appreciate your perspective.
Thank you. And if I may just add one more thing. If a woman needs breast or cervical cancer screening, she can contact the Promise Fund, no matter what their insurance status. The number is 877-427-7664. Thank you.
Thank you. Again, really important information there. Dr. Dodson, thanks so much for joining us.